patients here, and we just got her off the table and got her pelvis all nice and level. And she's done her level 3 pelvic stabilization core strengthening exercises this morning, and her core is really strong. But she has an issue with the unstable pelvis thing, like so many people do. And I wanted to show you today how using your lats can pull your pelvis out of alignment, because this is really important for personal trainers and just people that, you know, everybody that exercises that has back issues. So you can see right here, I just got Mimi off the table where I got her pelvis nice and level and stable, and you can see how, you know, my thumbs here are nice and level. So what I'm going to do is I'm going to give her just 2 kilograms, which is about 4.5 pounds or so, and I'm going to have her do a few, just some lat rows, or just some rows that a lot of people would do normally in the gym, and then we're going to look and see what happens to her pelvis. Okay? So Mimi, I'm going to have you do. Why don't we start out with just 5 reps of 4.5 pounds. 1, 2, 3, 4, 5. Okay, great. All right, then we're going to look at your pelvis again. You can stay right there, Mimi. And we're going to come up over her pelvis again, and there it is. Do you see the difference? How the left side of her pelvis is now up, and it's basically, this has rotated back because the pull of her lats, which comes right down and it inserts right on the top of her iliac crest here, has pulled her out of alignment.
I felt it when you did that. I'm like, oh my gosh, you could totally feel how, I can't believe how much it came out. Unbelievable.
Yeah.
Shocked me for that low weight.
So Mimi, I'm going to have you do a side bend stretch, and let's fix it, okay? So you can see how Mimi's going to correct this now. So she's going to stretch the left side, okay? Because it's her left quadratus lumborum and the lats here that have tightened things up and pulled her out of alignment. Tuck your pelvis under. Looks good. That's a good side bend stretch. And let's come on up again. All right, and let's just see how much that leveled you out. And it got you closer. It's not all the way there. So now I'm going to have you do a muscle energy balancing technique in the seated position over here, Mimi. Because we're getting her pelvis back level and stable, because when the pelvis is off like that, it creates back pain, and it sets people up for herniated discs, degenerative joint disease, degenerative disc disease, more arthritis and stenosis, and all kinds of problems. Sciatica, scoliosis. This unstable pelvis is, you know, the pelvis is the foundation of the spine, and when it's tipped, it causes all kinds of problems. So as a physical therapist, personal trainer, etc., you want to be able to keep everyone's pelvis level and stable, because that's going to keep their pain and dysfunction away. All right. So you did a muscle energy balancing? Not yet. All right. So Mimi's going to do a muscle energy balancing technique, which can help to level her pelvis out. And let's come on up again, and let's look at your back, Mimi. There we go. So she had to do a side bend stretch, and then a muscle energy technique, and now she's level again. But most people are not going to be doing that, so they're not going to understand how to correct their pelvis. So I have to encourage everybody to just stay away from doing lat pull downs, rows, any kind of exercise that's going to make the pelvis more unstable. I'm going to have you try one other thing that's really common in the gym, Mimi, with 10 pounds. I'm going to have you use this exercise bench over here. And on this left side here, what I want you to do is just kind of come straight up like this, okay? And a lot of people do this for for not only lats, but some tricep work. And I'm going to see again what this exercise. Okay, so this uses lats, biceps. So this is a 10-pound weight. Okay, and you can put that weight down on the exercise bench there. All right, and let's see what that did to your pelvis, okay? All right, so here we go again. She was nice and level and stable before. And there we go again. She's pulled out of alignment. This is going to cause her back pain and a lot of issues down the road. So let's do that side bend stretch again, Mimi. Get you back level and stable. So you can see that exercise, it uses the lats. The more you isolate and use the lats, the more it pulls the pelvis out of alignment. And she's got a really strong core. She's at my level 3 core strengthening exercises, which are killer. So, you know, Mimi is fit. But you can see just the wrong exercises really can pull people's pelvis out of alignment. Okay, so let's work to get her back in. And the side bend stretch got her leveled out again. So we're good to go. So Mimi and I are going to do some other exercises now that are good for mobilizing her spine, and we're not going to use lats. All right. Because the resistance
pulling
has
down?
to be pulling.
Oh, it's pulling.
Yeah,
so it's the
pulling
pull
down.
portion. Okay.
And like swimming.
Oh, that would totally do it because
You
you're
know.
out.
You're pulling down and there's the resistance of the water. Paddling, kayaking, stand-up paddle, rock climbing.
Oh, yes.
Rock climbing. You're not going to be pole vaulting, are you? But yeah, anything where you're really pulling.
Pulling your body up.
Yeah. Surfing and you know, swimming. So yeah, so I just get people to get up to that level 3 pelvic stabilization exercises so that they do that before they get in the water or whatever they're going to do that activity. And then as soon as they get out, they do their stretches and the muscle energy balancing technique to level it out. So it's about getting them trained to understand, you know, because a lot of times they won't feel the pain right away, and it'll be a couple hours later or the next day they'll be like, oh geez, what did I do? You know, because movement inhibits pain, so while you're doing the activity, a lot of times you don't feel it. You know, but then later you're going to be sore, and again, it sets you up for more serious issues too, to have your whole foundation tip like that. You know, okay?
All right.
All right. Thanks, Mimi.